Well, I'm absolutely delighted now to be joined by AUA Secretary Dr. Gopal Badlani. Dr. Badlani, welcome.
Thank you very much.
Thank you very much indeed for finding the time in your schedule today to talk to us.
It's my pleasure.
Now, what a great meeting this is, isn't it? Over 17,000 folks you're expecting here.
It's absolutely exciting to have all these people here and to see the place in production after planning it for a year now.
Now, you talk about planning it. What are some of the hot topics for this year's meeting?
Well, the hot topics this year, we have a very world-renowned Latimer speaker, Eric Topol, who's going to speak about the future of medicine. And we have live surgery on 2 days, Saturday and on Wednesday. This is the first time we have had live surgery on plenary. We have science in medicine in the sense that we've had already on Friday research. This is the first time we've had a full day of research, which was very exciting to see.
When you planned the meeting, when you put all that work in, what were your goals?
I think the goals is innovation and outcomes. That's the primary goal, to show new things and of course look at how we perform. But you got to make the meeting interesting for a urologist that is coming all the way here. So there are a variety of things, and I think live surgery adds a new feature. We have video debates. We do a lot of variety of things for different audiences to keep them engaged right through the meeting.
Now, you talked about different audiences. I mean, that's one of the challenges, isn't it? You've got over 17,000 people here. How do you cater for all the different subsets and all the specialties within that group?
I think we take input from each one of those groups. So in planning, we have suggestions from each of those groups. So it starts with residents. So we have a whole resident track, including a specialized session for them related to research yesterday. And then we have the resident bowl, a resident debate, and showing them the way or pathway to practice. And we have, on the other end, the nurses and the physician's assistant who cater their own program, basically telling us what they want to learn, and we have special courses for them. In between, we have PhD scientists, and we have programs for them, and the international audience and a domestic audience. So programs cater to each group.
Programs for everybody.
Yes, absolutely.
Now, one of the things, you touched on it there, the international audience. Out of these 17,000 or so folks, quite a number of people here from different countries. How do you cater for them?
I would say over 50% of our audience is international, coming from over 120 countries. And of course, what we do is we again have country-specific or language-specific courses, particularly on Saturday. And then you have subspecialty programs, and the subspecialty programs cater to their particular needs. We have Spanish translation, because a large part of the audience comes from South America, Central America, and Spain. And of course, there is the generalized program. Live surgery is very interesting to them because they can relate and see the procedures. So in general, we cater to the international audience separately.
Well, Dr. Badlani, thank you very much indeed for joining us today. It's a fascinating program. We hope you have a great week. So thank you very much indeed.
My pleasure.
Thank you.
I hope everybody has a great time.
Thank you.